Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for joining me again this week. I am Jeannie Pete, and today I am here with a very appropriate show for summer in Atlanta and everywhere. I am here today with Dr. Mark Chastain, who is with skin cancer specialists in both Marietta and Noonan, Georgia. But what we're going to discuss today is going to pertain to you folks out in Arizona, the Gulf Coast, anywhere listening, anyone who's out in the sun and may not have had a full body check to make sure that they are free of skin problems, including melanomas and skin cancers. So we have a lot to talk about today. So Dr. Chastain, thank you so much for joining me today.
Thank you for having me.
First, let's talk about you and how did you get involved in this type of practice, and what do you do?
Well, I'm a dermatologist. Went to school after medical school, did a residency in dermatology, and then I was particularly interested in skin cancer and in the management of skin cancer patients, and so did a fellowship in Mohs surgery and reconstructive surgery for skin cancer. So the focus of my practice for years has been skin cancer and the management of patients who have skin cancer.
Yeah, in you getting me information for today's show, I was very alarmed to read one of your statistics, which is that approximately 1 in 5 Americans will get skin cancer in their lifetime.
That's correct. Skin cancer has increased so dramatically in recent years that over half of all cancers now are skin cancers, and there's I think roughly 3.5 to 4 million cases of skin cancer every year in the United States, and it is estimated that 1 in 5 people will get skin cancer in their lifetime.
Do you know, because I don't have it here, but of the folks that get skin cancer detected and treated, what are the rates of survival? Is it? I think different types of cancers are different, so this is probably too vague for you. But how destructive is skin cancer to our lifespan?
Well, virtually all skin cancers are completely curable as long as they're caught early. There's 3 main types of skin cancer: basal cell carcinoma, squamous cell carcinoma. Those are the so-called non-melanoma skin cancers, which are, generally speaking, not life-threatening, but they do continue to grow and enlarge until they're removed, and they can be disfiguring and can be quite destructive. The third type of skin cancer is the melanoma-type skin cancer, which fortunately comprises only 4% of all skin cancers, but it is the form that is the most deadly and is potentially life-threatening. And approximately 9,000 people die every year from melanoma-type skin cancer in the United States. That's approximately one death every hour in the United States.
And yet, if it's caught early, it's totally curable.
Exactly. In fact, there's probably somewhere around 100,000 cases of melanoma-type skin cancer in the United States every year, and approximately 9,000 deaths. So 90% of those, or 91,000, give or take the numbers, 91,000 of the 100,000 cases are surviving the diagnosis, and that's because we're catching these earlier and earlier. Back 30, 40, 50 years ago, melanoma was frequently a fatal diagnosis because patients there wasn't the awareness of skin cancer that there is now. Patients weren't coming into the doctor and getting things on their skin checked. And so frequently when a melanoma was detected, let's say 40 years ago, it was caught too late, and the patient oftentimes ended up dying from it. Nowadays, melanoma survival rates are much better because we're catching them much earlier. So even melanoma-type skin cancer, the deadly form of skin cancer, is entirely curable if caught early. And so early detection and getting checked are very important, obviously.
And what do you consider early? I mean, because, I have fair skin with freckles, and so something may seem bumpy is early after a few months or in the first year or two?
Well, as a general rule, anyone who has any sort of risk factors for skin cancer probably should get a baseline skin check with their dermatologist and just get a good look over, and then there can be an assessment as to how often that person needs to be checked. But as a general rule, if a patient has anything on their skin that is changing or growing or evolving, for a period of several weeks, a month, let's say, and it's continuing to do that, then that patient ought to get checked.
Yeah, and in preparation for this interview, I have to tell you, I did go online and checked out different images for basal cell and squamous cell and melanoma, and it's a good thing I have an appointment coming up with your office because it's scary as an Irish, fair-haired, freckled person. It seems like I'm doomed at some point in my lifetime.
Well, if you're fair-skinned and you've seen a lot of sunlight over the years, then you do have a significant risk of getting a skin cancer in your lifetime. And this becomes more problematic as we age. The elderly are particularly prone to skin cancer. The incidence really never gets better as we age. As we continue to age,
yeah. On that note,
skin cancer keeps going.
Yeah, that was my next question. Is there a typical age frame where you see it more?
Well, skin cancer can occur at any age, although it is particularly uncommon in children, very uncommon in children. We occasionally see a skin cancer in someone in their 20s or 30s, but it really becomes more common in older patients. So some fair-skinned patients who have a family history of skin cancer who have seen a lot of sunlight over the years might get their first skin cancer in their 40s or 50s. But I would say our average age for skin cancer is significantly older than that. So a lot of our patients that we manage for skin cancer are in their 60s, 70s, or 80s.
Okay. So let's go back to the different types of skin cancer and kind of talk about the differences between all three. Because what I want to do is and also the effects of the sun. We have so much to talk about today. But, it is attractive to have some color. Everybody looks
That's
better
your perspective.
With a little bit of color.
I think pale is beautiful.
I know. And when you walk into your office, you've got, you'd think you were going fishing or into a bee's nest with what y'all recommend we wear.
Right. Well, it's all part of, the perceptions in our society. And, of course, over a number of years, it's been considered attractive to have some color to your skin. And we'd like to change that. The Nicole Kidmans of the world, I think, are helping change that so that pale can be considered beautiful.
And you're right.
I've had other patients, though, who jokingly tell me that brown fat looks better than white fat.
Well, that too. You do think you look better in a bathing suit on the beach if you have color. But anyway, on a serious note, so that is an uphill battle. And pale is beautiful, but most people I know do feel better when they have a little bit of color. And so this is a scary subject because, as you said, it's increasing. And I don't think it's increasing because people didn't go to the beach before, but are there differences in the rays that the sun is emitting these days versus 50 years ago, or are we just more aware?
Well, it's probably a combination of things. The incidence of skin cancer is increasing dramatically. We're not exactly sure why that is, but there's probably several factors involved. Number one, people have postulated that the changes in the ozone layer are causing more ultraviolet light to be emitted or to reach the Earth's surface. So that may be part of it. There's certainly better diagnosis, people getting checked, whereas in the old days, people didn't really come in and get their skin checked. And so there's certainly more skin cancers being diagnosed as a result of that. But probably the biggest factor has been the aging population. The aging population is certainly where we see a great number of skin cancers. And
the products that are out on the market today, just not good enough? You really just need to cover up?
Well, I wouldn't go that far. There's a lot of very good products on the market: sunscreen, sunblocks, There's sun protective clothing. There's hats that are made specifically to protect your face from the sun, and all those are great products. But nonetheless, if you're outside, even with a good sunblock on, with a high SPF, you're still getting sunlight through the sunscreen or sunblock. It's not 100% block. So that's why we recommend not only sunscreen or sunblocks, but hats and protective clothing. We also recommend that patients try and minimize their outdoor activities between the middle of the day, between the hours of 10 and 4, whenever possible. If you have the option of mowing the grass at 7 a.m. or at noon, we'd prefer you do it at 7 a.m.
Okay. So again, let's go back to, yes, so we do need to cover up more. We do need to move more towards the pale is beautiful, but I still think it's a problem because people are outside and uncovered and not using products, and we have an uphill battle, as I said. So
sure.
That being said...
As long as being outside is enjoyable, then patients are going to grow skin cancers.
Right. So how do they help themselves?
We just recommend patients use appropriate precautions.
Right. So if you're doing a self-skin check, because, it's not as easy as people would think to spot the troublesome spots on your body. Because a lot of them look like moles, or they might be nothing, or mistaken for, what's it called, keratoses. And so how do we know when there's something of trouble that we need to get looked at?
Well, as I mentioned before, getting a baseline check with your dermatologist is always a good idea. But what we generally look for, the basal cell carcinoma and squamous cell carcinoma, those lower grade forms of skin cancers, usually present themselves as a sore that won't heal, a spot that's bleeding spontaneously, a place that's growing, a sore that just won't go away. Or maybe a reddish pink patch that continues to enlarge, or is persistently scaly. And those skin cancers most often occur on the head and neck area, also the arms, chest and back, really sun-exposed areas. They can occur anywhere, but really most common in sun-exposed areas. Sometimes a basal cell carcinoma, the most common form of skin cancer, can really look a lot like a pimple. And so that's why to keep you from going to the dermatologist for every pimple, that's why we usually say, give it a month or 6 weeks. If it's a pimple or a hair follicle gone bad or a scratch or something of that nature, it should heal within a several-week time frame. If after 4 to 6 weeks, a spot like that is not gone away, a sore continues to bleed and not heal, then the patient ought to have that checked. Patients with melanoma skin cancer, looks entirely different. Melanoma type skin cancer looks generally like most commonly like a black irregular mole. Some of our listeners may have heard of the so-called ABCDs of melanoma. So you look for anything with asymmetry, so asymmetrical features. B stands for border irregularity, so jagged edges. C stands for color variation, so a mole that has different colors, and D stands for diameter, so greater than 6 millimeters. So really, melanoma usually looks like a dark spot, oftentimes a black spot with some irregular borders and maybe jagged borders and some irregular coloration. And particularly if that mole is, and really melanoma is essentially a malignant mole. So if you have a mole on you that's tan-colored, it's round, it's uniformly brown, most commonly those are benign.
What you can't see is me checking out my shoulder and my arm.
Exactly. So, but that mole, if it begins to change and starts getting, irregular borders or multiple colors within it or starts turning dark, then it should be checked. And getting for patients at risk, getting a skin check with a dermatologist, let's say once a year, is a good idea. We also recommend that patients, to your point, do a self-skin exam, and we recommend that particularly for patients at risk once a month in the mirror. So you stand completely undressed in the mirror with and use a handheld mirror and really look at every square inch of your body and look for anything that's evolving or changing or new or something that wasn't there 6 weeks ago, and be aware of your moles. You know, you want to be aware if something is new or changing, and it's also helpful to have your spouse or a family member or loved one to help out with that. Now, as we age, a lot of patients will grow what you referred to as keratoses, what are we call seborrheic keratoses. Those are the barnacles that patients get. Almost everybody over 40 or 50 has one on them, and they just look like a little rough, little warty, rough, pasted on little place that sometimes can get irritated and bleed. But those are generally benign, seborrheic keratoses, and a lot of patients who are over 50 or 60 or 70 years of age will have 10, 20, 50, 100 of them. My father, who's 88 years old, has probably 600 of them. Unfortunately, he passed the gene on to me, and I'm starting to grow them.
Yeah. Now, are they at risk of turning into something more dangerous if not removed, or no?
Seborrheic keratoses are very, very common. As I said, most everyone over 50 or 60 years of age has one, and they are not true moles. They're just basically barnacles of old age. We sometimes call them wisdom spots, and they never, ever turn to cancer.
Okay.
So what can turn to cancer, or where melanoma can evolve from, is a mole. So that dark, brown mole that you've had for years and years, that has a small risk of at some point turning to melanoma. But seborrheic keratoses, the barnacles of old age, those typically never turn to skin cancer.
Okay, and then is there a different feel for people that I want to influence folks to do a body check, and then I also want to get your information out so that they can make appointments for a professional skin check. But is there a different feel between the keratoses and the carcinomas or the melanoma?
Well, melanoma in particular, a lot of patients will think that melanoma should be raised. Virtually all melanomas are flat when they start. They're just a dark spot that's completely flat on the skin surface. The seborrheic keratoses, the barnacles, are almost always raised. They have a roughness to them, and they're raised. Basal cells and squamous cells can be flat or elevated, but those are usually pink to reddish in color, and can look just like a sore that won't heal or a spot that's bleeding. They can be flat or raised.
Okay. Now, this is just a personal experience, but I want to ask because it may impact folks that are listening as well. What about a spot? I like I said, I'm Irish with freckles all over, and a spot just got clear white and no freckles have grown on it, and now it's a little bit pink. Anything like that people should be concerned with, or? Sure.
Not every single melanoma is pigmented, so you can have something that's called amelanotic melanoma, which is a melanoma that does not have pigment in it, and it can be kind of white or pinkish. And there has to be some index of suspicion on the part of the clinician who's looking at it. And if there's any reason to suspect that it could potentially be a problem in the dermatologist office, it's easy to just take a biopsy of it.
Okay. So I just wanted to get that out there because it did happen to me, so I want folks to be aware that that's something to look for too. I have more questions for you, Dr. Chastain, but I do want to get your information out about location and contact if someone wants to schedule. And please, folks, you should get a baseline and schedule as per the dermatologist's suggestions after your baseline. So can you give information on where your offices are located and how folks can get in touch with you if they want to schedule an appointment?
Sure. My primary office is in Marietta, Georgia. That office number is 770-422-5557. And then we also have a satellite office down in Noonan, Georgia. And then I also work at two other offices in the Buckhead area of Atlanta, and then also in Athens on Oglethorpe Avenue.
Okay, and the best way to get in touch with skin cancer specialists, is there a 800 number or is it a Marietta office?
The Marietta office
Okay.
is, I gave the phone number 770-422-5557. The Noonan office number is 770-502-0202. We also have a website for each office, www.skincancerspecialists with an S on the end.com. That's for Marietta. And then the website for Noonan is www.skincancerspecialists with an S on the end -Noonan.com.
Okay.
And so anyone can go to the website. There's also on our website, there are pictures of different types of skin cancers and some general recommendations that we have about skin cancer management.
I do want to talk about coverage and treatment, but you brought up a thought as you were talking about the different offices. Is it better to go to, who's the best physician to go to? Because you think skin cancer, do you go to an oncologist? Do you go to your primary care physician? Do you go to a specialist? I know I scheduled with you because I was worried about skin cancer a few years ago. But is there something that folks should look for when choosing a doctor?
Really, just an office with a board-certified dermatologist is really fine. You know, skin cancer is so common, with there being over close to 4 million cases of skin cancer every year, that virtually every single dermatologist anywhere in the United States is very proficient at diagnosing and managing skin cancer. So, as long as you go to an office with a board-certified dermatologist, you should be able to get a good set of eyes looking at you.
Okay, great. And for some of our listeners, we have a half-hour show, and for other listeners, we have a full-hour show. So there's more I want to talk about in terms of coverage and treatment. But for folks that are listening out there in Arizona or the Gulf states, New Orleans, please do at least go to the website. I know it's in Georgia, and that's www.skincancerspecialists.com, and it'll give you great information and images and resources for you to look up, and you can please schedule a baseline appointment for yourself in your market. I do want to talk about coverage and treatment real quick. Are these types of exams covered by insurance typically?
Yes, they generally are covered by insurance.
Okay.
So that's not a problem.
So that has come a little bit that's come a long way in the last, say, 5 years.
Well,
10 years.
Generally speaking, having a full body examination for skin cancer, usually there's things that patients have that have on their skin that they're concerned about, and they'll point to specific areas. And generally speaking, that's covered by insurance as well as by Medicare.
Okay, great. So folks, please don't be afraid to contact your dermatologist, contact your insurance company, make sure it's covered. But this is preventative medicine. And as Dr. Chastain mentioned early in the show, skin cancer is mostly curable. It's just about catching it early. And so please don't wait. Go and get a baseline and then listen to your dermatologist about how often you should come back and be seen and checked to make sure we can keep you as healthy as possible. The show is called Better Living. Please stay tuned, and when we come back, we're going to talk more about treatment options, the differences between basal, squamous, and melanoma, and more about coverage. Hello, I'm Jean Pete, and I welcome you back to our show, Better Living. Better Living is brought to you by the Homestead Hope Foundation and is sponsored by Homestead Hospice, where commitment to education and premier hospice care helps patients and families through life's most important journey. Thanks for staying with us today on Better Living. I'm Jean Pete, and again, I'm back with Dr. Mark Chastain from Skin Cancer Specialists. And I actually wasn't aware, Dr. Chastain, of how many offices you did have. I knew there was one in Buckhead, Georgia, and I knew you worked out of the Marietta office because that's the office I went to a couple years ago. But have you grown recently? Are you going to continue?
No, those other two offices belong to other dermatologists. I just go and basically assist them in the management of their patients. The office in Buckhead is really Dr. Rutledge Forney's office.
I see.
And the office in Athens is the office of Dr. Joy Chastain, who happens to be my sister.
Okay, note the last name. Okay, so folks, anywhere in Atlanta, you can get your skin checked by skin cancer specialists because they have pretty good coverage in the south, the north, right in the heart of Atlanta, all the way out to Athens. So please, we touched upon it in the first half hour. Make sure to be checking your skin, having your spouse check your skin, your relatives, your sister, because you can't always see what's on your back and shoulders. And also, as we touched upon in the first half hour, where your typical sun exposure occurs is where you're at most risk, which is logical. But that would mean, Dr. Chastain, I would think shoulders, arms, neck, face are most susceptible areas, which is where we absolutely don't want to have anything happen or ugly spots occur.
Right.
So let's talk about if that does happen, and we do find that we have either a basal cell, a squamous cell, or a melanoma. What happens next?
Well, once the initial thing is usually you go into the dermatologist's office, they will do a biopsy to confirm the diagnosis or to take off a suspicious spot or take a biopsy of a suspicious spot. That the pathology report comes in and it says skin cancer, either basal cell, squamous cell, or melanoma. Most commonly. There's a number of other types of skin cancer, but those are much less common. The three main types are the types that I mentioned. And then at that point, once the pathology report comes back, then the treatment is initiated. And the treatment consists of a variety of different ways to manage each of these types of skin cancer. The melanoma type skin cancer, the only real reasonable treatment option is surgery. That is to cut it out and stitch it up. And now, as long as the melanoma was caught early, then the only thing that the patient may need, the vast majority of the time, is to have it surgically excised. And that is, generally speaking, curative. Now, if the melanoma is not caught early, and the initial biopsy suggests that the melanoma was not caught early enough, then that particular patient may need to be referred out from the dermatologist's office to go somewhere else to have either lymph nodes removed, to possibly even have chemotherapy or radiation, or blood tests, X-rays, and all sorts of things, undesirable things. The key is obviously to catch it early, and then the only thing that needs to be done is to have it surgically removed.
Now, can we talk a little bit about melanoma, and then we'll get back to the other two? It's a fast-growing cancer, isn't it, or am I wrong?
Well, it can be. It's not always a fast-growing skin cancer, but it certainly can be fast-growing. And the outcome with melanoma patients depends on how deeply that melanoma has spread into the skin. The deeper it goes into the skin, the worse the potential outcome. Now, some melanomas, for whatever reason, will grow laterally on the skin. So they grow side to side, but they don't grow deep. So they can get kind of large in diameter on the skin surface without ever becoming seriously life-threatening. You have other melanomas that will get to be only, let's say, 8 or 9 millimeters in diameter, a fraction of an inch, and start growing very deeply. And those can end up spreading to the lymph nodes and can even be deadly.
Okay.
So melanoma can be fast-growing, and when it does spread, it spreads to the lymph nodes, and then at that point it can be, very, very life-threatening.
Okay, and just to remind our listeners, it's typically dark and flat, but it would grow to look irregular, and that's where you went into your A, B, C's, and D's, asymmetry, border, color, and diameter, right? Did I get that
Correct.
Right? Okay.
The weakest of those criteria is diameter. There's an occasional melanoma that is less than 6 millimeters in diameter, but the majority of them are greater than 6 millimeters. But yes, anything that looks like a mole, it looks like a dark mole, but it's irregular, it's got jagged borders, it's got a couple different colors in it, it's dark, it's black, got some black coloration in it, those are the signs to look for melanoma.
Okay, but typically it's softer. The more rough or scaly, I hate the word you use, but it's a good one, barnacle-like, may not be a skin cancer, but get yourself to the dermatologist quick to get it looked at.
Exactly, because it takes a trained eye to tell, because sometimes a barnacle, a seborrheic keratosis, can look a lot like a squamous cell carcinoma, and sometimes even can look a lot like melanoma, because those seborrheic keratoses can be quite dark. And we do teach our patients anything that's dark really should be checked. Anything that's black or dark in color ought to be checked.
Okay, so you mentioned that melanoma can grow in different ways. It can be flat and spread throughout the skin, or it can go deep, and deep means typically worse outcomes if not caught early enough before it gets into the lymph nodes. With basal cell and squamous cell, how do they grow?
Basal cell and squamous cell carcinomas, they typically grow in all directions. Basal cell carcinoma virtually never gets into the bloodstream or into the lymph vessels, and virtually is never life-threatening. I say never, but it's hardly ever life-threatening. But they can be quite destructive. By definition, these are cancers because they continue to grow without any boundaries, and they continue to grow until they're removed. So if you ignore a basal cell carcinoma on your nose for 5 or 10 years, it can literally destroy the end of your nose. It can cause quite a destructive place on your nose. Squamous cell carcinoma is similar to basal cell carcinoma, but in rare instances can be life-threatening. If a patient, and there's some risk factors for that, if a patient has a squamous cell carcinoma that's been treated multiple times and keeps coming back, has a location on the lip or the ear, is occurring in a patient who has a weakened immune system, such as an organ transplant patient, one that is rapidly growing, or a squamous cell carcinoma that's particularly large. Those are risk factors for spread. But your standard, small, caught it early kind of squamous cell carcinoma, those are generally completely curable.
Yeah, I've heard if you see a new spot on your lip, don't wait.
Squamous cell carcinoma can be particularly bad if it's on the lower lip. And that's the lip or the ear are higher risk locations. So you're right. Anytime you have something that's not going away on your lip, it should be checked.
Yeah, I'm ready to drive over to your office as soon as we're done here. Oh, Lordy. Okay, so let's talk about risk factors. Who should be most concerned and most aware and diligent?
Well, patients who have fair skin are at greatest risk for skin cancer. It's not impossible for patients with darker skin tones to get skin cancer. It's possible, but it's much less likely. So, fair skin patients are the most are the ones at greatest risk for skin cancer. And then also patients that are aging or the elderly are particularly at risk. So those are risk factors. Also, patients who have a family member who's had skin cancer, that is a risk factor. And certainly a patient who has one skin cancer is certainly at increased risk for other skin cancers. Patients who have a lot of moles are at increased risk for skin cancer, particularly melanoma. Patients with a significant history of prolonged sun exposure. So if you've seen a lot of sunlight in your lifetime, that's certainly a risk factor for skin cancer.
Okay. This is not making me happy.
I'm assuming some of this applies to you.
Just a little. And the thing is, when I came to you, this is going to be for the benefit of our audience. When I came to Dr. Chastain, I had the full body scan, which was very fun, by the way. Not really. And very relieved that most of because when you have the fair skin and the freckles, and you said the keratoses are very common, it was a sigh of relief. Okay, I just happen to have these things growing on me, and no problem with skin cancer. So I left, which I think might be typical of many people, and really didn't stay diligent and come back. I really should have come back probably 2 years ago. So I don't want people to do what I've done, because now I really do have some concerns, and I can't wait to get in there so that I can hopefully breathe another sigh of relief. But please don't do what I've done. I actually went to be diligent, got the baseline, said, phew, okay, now I'm going to not wear the hat that's in his office, even though I should, but really use sunscreen, not go into tanning beds. That's a whole nother issue I want to talk to you about, and truly care about the health of my skin. And I don't live dark. I really don't. I'm pretty careful with the sun as well. I'm pretty fair skin. I do get a tan in the summer, but not often. But please, folks, it's not worth it. I had a neighbor die of melanoma a couple of years ago, young guy in his 50s. Wife found a bump on his shoulder. By the time they found it, it was in the lymph nodes, and it's scary. And I don't mean to scare you all to motivate you, but truly go and get that baseline. Truly call Dr. Chastain. And again, that Marriott office number is 770-422-5557. Or if you're in the Noonan area, 770-502-0202. And you can also go to their website at www.skincancerspecialists.com. I know Noonan has a different address, but I'm sure they can get to the different locations from your main one.
Yes.
Okay, great. So now that we know the risk factors.
The only other thing I'll add is just be aware of what's growing on your skin. So some patients who get into trouble with skin cancer are those patients that have no idea what's on the middle of their back or no idea what's on their arms. So just be aware of your skin, what's on it, and be aware if anything's changing.
And especially the melanomas, which
Sure.
are the scariest kind, because they're the hardest. They're the ones that you might think are nothing. The other ones you can kind of see, oh, I better get this checked. But sometimes those melanomas can go under the radar for a while.
And the fact is, the vast majority of skin cancers are asymptomatic, which means they don't cause any symptoms. So melanomas don't cause, generally speaking, don't cause any itching, or they don't bleed. They don't really do anything. They don't cause any problems to the patient. They just sit there until it's too late.
Well, that's good to know. So if it's itchy...
We wish melanomas would itch, and then patients might come in a little earlier, but they don't.
Okay, so the ones that itch might not be the melanoma. They might be that keratosis. Okay, I'm feeling a little better.
Yeah, occasionally patients will say their melanoma itched, but it may just be that the skin in the area of their melanoma happens to itch. If their melanoma is in the middle of their back, well, they may itch back there, but of course a lot of people itch, and most people itch in the middle of their back from time to time.
Okay, a couple more questions I have, but before I go on that, regarding a melanoma, if you have a melanoma and you're treated and the biopsy comes back that you have it and you have the surgery and you have it removed, how often then should you be going back to your dermatologist? Yearly or even more?
Generally, the recommendation is every 3 to 6 months for 2 years, and then every year thereafter, after the 2-year mark. Now, depending on what else is going on with that patient, if it's their second or third melanoma, or they've had 5 basal cells in addition to the melanoma, they may need to be checked more than that. But for the standard patient with no prior history and 1 melanoma, it's generally 3 to 6 months, every 3 to 6 months for 2 years with a dermatologist.
Okay.
And then every year thereafter.
With a dermatologist, then each year. Okay. Yeah, because I have a sister also, not that this is all about me, but I use my real life experiences to help folks that are listening who did have a melanoma on her back that she didn't notice, really didn't think anything of it, went for a skin check somewhere else. They found that and removed it. I don't know that she's been back. We're not very good patients in my family, I guess. So I might be making another appointment for you or dragging her with me.
You're not alone. There's a lot of patients. I've been a little bit lackadaisical myself about seeing a primary care doctor. So that's how it goes sometimes.
Yeah. So I do want to talk.
Lives and get busy.
Yeah, I do want to talk a little bit about the sunscreens. We touched on it early in the show. Because I'm concerned that the rays are different coming from the sun. I don't know. I've moved down from Boston to Georgia, and it's just hotter down here, but it seems like more and more people are concerned with what they've got on their skin. So what are there better sunscreens than others? Now you're seeing 70. Does that really make a difference from 35?
That's a good question. And it is certainly true that there are more skin cancers in the southern latitudes. So if you lived your entire life up in Boston, you might have a slightly lower risk of skin cancer than if you lived in Georgia or New Orleans or the Gulf Coast or Florida in particular is a problem. So we just spend a lot more of the year outside, in the Atlanta metropolitan area. It's, very nice outside 10 months out of the year, so we get a lot higher dose of sunlight on a yearly basis.
Yeah, that's logical, actually. Okay. So what about these sunscreens?
Well, we recommend that patients use sunscreen on a daily basis to all exposed areas. That includes the top of the ears every morning. And we recommend you use a sunscreen with an SPF of at least 30 or higher. Now, once you get past 30, the efficacy sort of levels off, so that 15 to 30 gives you some improvement, but once you get past 30, 50, 70, 90, those don't really give you a whole lot of additional protection. The sunscreen really needs to be a sunscreen that protects against both UVA and UVB rays. And the vast majority of the sunscreens on the market now do protect against both UVA and UVB rays. Both types of UV light have been implicated in skin cancer as well as premature aging. So you want to get a good broad-spectrum sunscreen and apply it every morning. And then if you're in direct sunlight, you really should reapply every 2 hours. And you should also make sure that after you swim or do vigorous exercise that you reapply the sunscreen because it tends you tend to lose some of the efficacy with exercise. And then also a sunscreen that's water resistant is also helpful. And it's important to apply the sunscreen 15 minutes prior to exposure to sunlight. Now, some patients have a favorite sunscreen, and generally speaking, that's fine. There's both sunscreens and sunblocks. They work a little bit differently. Blocks work sort of as a physical blocker. The sunscreens are more of a chemical blocker. But whether you use a block or a sunscreen is really not that important. What is important is that you find something that you like, has an SPF of at least 30, it's broad spectrum, and that you use it on a regular basis and reapply.
That's helpful. I didn't know the difference between the block and the screen, and that really it's not a big difference. It's just whatever feels good on your skin.
Exactly. They both work. They work very differently, but they both work. And as I said earlier in the show, that even the best blocks and sunscreens are not 100% protection from the sun. That they still allow a little bit of sunlight through. So just be aware of that. Even when you have sunscreen on, you're getting a little dose of sunlight, and that's why sun protective clothing and hats, wide brim hats, are particularly important.
Now, what about sprays versus lotions versus oils? I mean, is there a better product, or is that along the same lines as physical versus chemical, block versus screen?
Well, the formulation that you use isn't particularly important, whether it's a gel or a spray. I think sometimes, and I know this just from my own personal experience, sometimes with the sprays we don't get quite the coverage that we might get with the lotion. And so you have to be careful to use enough of the spray. But whether you use a gel or a stick or a lotion, it really doesn't matter. It just matters that you use something.
Okay. And then the topic of tanning beds. How are we doing as a population with that? Because I know that came out years ago. Are we getting better or worse with that?
We're not getting any better. Okay. I can tell you that. Tanning beds are particularly a problem in younger patients who aren't really that focused on the effects of sunlight and effects of UV light. But we even see some older patients that go to the tanning bed. Tanning beds emit UVA and UVB light, so similar to the sun, and it's just as damaging as sunlight. So tanning beds are really a problem. In fact, the World Health Organization has labeled them as a carcinogen, meaning they're considered a cancer-causing substance, tanning beds. So,
are they worse than the sun?
Well, I get asked that question a lot, and certainly there are aspects of the type of ultraviolet light they emit that is worse. I'm not sure I would say that it's worse, but it's just as bad.
Yeah, and now they're showing up in all kinds of gyms.
Oh, sure.
So and more easy to use. They come with the memberships. It's free because you're paying them monthly.
It's profitable to own a tanning parlor. So as long as it's profitable to own tanning parlors and patients perceive that it looks good to have a tan, people are going to continue to do it. But to reiterate an earlier point, sunlight and artificial tanning beds, not only does it cause skin cancer, but it also causes premature aging. So all of those brown spots and sunspots and wrinkles and fine lines, all of that is attributed not only to aging, but also to sunlight and tanning bed exposure. So there's two good reasons to minimize your sunlight and minimize tanning bed use. Number one being skin cancer, but also the fact that the issue of premature aging.
Pale is beautiful, people. How'd I do?
Exactly.
Okay. Can we talk a little bit? We only have a couple minutes left, but Mohs surgery.
Mohs surgery is one of the different treatment modalities for non-melanoma skin cancer. It's not the only treatment modality. There are a number of treatment options if any patient is diagnosed with basal or squamous cell carcinoma. For one thing, there's just excisional procedures where it's just cut out and stitched up. There's scraping procedures. There's freezing procedures. There's even radiation is a treatment modality for non-melanoma skin cancer. I do a lot of what's called Mohs surgery, which is a technique in which the cancer is removed layer by layer, where it's checked in the office under the microscope as we go along to make sure that the cancer is gone. And then at the completion of that, generally speaking, the patient has stitches or patched up with some sort of kind of plastic surgery type closure.
So it's real precise.
Type of surgery is that type of surgery, Mohs, is generally reserved for skin cancers on the face and cosmetically sensitive areas, or if it were on the trunk or extremity, generally an aggressive or large skin cancer might need Mohs, but certainly not all skin cancers need Mohs.
But typically to have something removed, it's not painful. You'd numb the area in whatever way, shape, or form.
Exactly.
Yeah.
The numbing medicine stings a little bit, but really after that, the patient is numb and doesn't feel anything. Regardless of the modality used to remove the skin cancer, it generally is not painful to have it removed once you're numb.
So much more painful, folks, if you don't get it detected early and you have to go for the least positive outcomes, which might include radiation and chemotherapy and all kinds of problems if it gets into your lymph nodes. So a little freezing or numbing and even the Mohs surgery, well worth it to go now to make an appointment with your dermatologist just to get a baseline body scan done. Is there any parting words you want to leave? We've run out of time today.
No. I just want to echo what you just said. Early detection is key. So we just suggest that patients who have any risk factors for skin cancer go to their dermatologist, get checked, and that way, if they do have something, it can be caught early, and treatment can be instituted early.
Well, thank you, Doctor.
It's curable.
Yes, it's curable, and we want everyone to live the best life possible. So go early. So thank you, Dr. Chastain. Again, he is here with Skin Cancer Specialists. You can go to the website at www.skincancerspecialists.com or call at 770-422-5557. I'm Jeannie Pete. Thanks for listening. Have a blessed day and week ahead. And listen here, same time next week and every week. Homestead Hope Foundation is your resource for a healthy life. God bless.